From the previous question papers of RRB, MRB, PGMOs, Rotak and BFUHS for Acute, we have selected important questions and we are producing you as mock test series. Welcome to Satu Career 2.0 online nursing channel. This video contains 50 questions, so don't skip the video, watch all the 50 questions so that it will be useful for you during the time of exams. Before going to see today's video, please subscribe to our channel to get latest notification about new videos. Please click the bell icon. Let's see the first question of the day. On which side of the client who has been affected by the stroke a nurse must stand while ambulating? Option A, on the client's affected side, B, on the client's unaffected side, C, in front of the client, D, behind the client. The right answer, option A, the nurse should support the affected side of the client so that to prevent falls. Question number 2. The most appropriate care for a client who talks loudly and agitated is A, report the behavior to the doctor, B, instruct him to speak slowly as his behavior disturbs others, C, speak with the client in a calm and comforting manner, D, none of this. The right answer, option C. When the client is speaking loudly and agitated, the nurse should not imitate that behavior. The nurse should speak very silently and in a comforting manner that will please that patient and his behavior will be controlled. Question number 3. An example of neglect is option A, applying restraint too tight, option B, calling for assistance when you care for the needed client, option C, changing the client's clothes as soon as you found he or she is soiled, option D, leaving the duty after handover. The example of neglect is applying a restraint too tight. Question number 4. Which sense lost at last in a client who is dying? Option A, smell, B, taste, C, vision, D, hearing. Among all these senses, the senses which will lost at the time of dying will be hearing sensation. So the patient who is going to die can hear whatever you are speaking. Question number 5. First sign of pressure sore is A, bruising, B, redness, C, bleeding, D, blisters. So in decubitus ulcer, the first sign is redness of the area where pressure is applied more. Question number 6. The following site is most frequently used in determining a patient's body temperature. A, oral, B, axillary, C, rectal, D, tympanic. The right answer is oral site is most commonly used to check the temperature of a client. We use other site when the oral site is contraindicated. Question number 7. The nurse knows the signs of hypoglycemia includes all except option A, hunger, B, polyuria, C, sweating, D, irritability. The right answer, polyuria is the sign and symptom of hyperglycemia. So option B is right. Question number 8. Fecal impaction may be present with among which of the following symptoms? Option A, dark urine, B, abdominal pain, C, excessive flatulence, D, small watery leakage of stool. The right answer, option D, small watery leakage of stool indicates there is fecal impaction. Question number 9. Which symptom indicates the onset of stroke? Option A, high blood pressure, B, prolonged vomiting, C, aphasia, D, memory impairment. The sign which indicates onset of stroke is option C, aphasia, difficulty in articulating words. Question number 10. Student nurse knows that clients on bed rest must be turned every option A 2 hours, B 6 hours, C 8 hours, D 1 hour. The right answer, option A 2 hours. Every 2 hours the position of the patient must be changed to avoid pressure sore. Question number 11. When acquiring vital signs, which of the following pearls will be most commonly used by a nurse? Option A brachial, B radial, C femoral, D popliteal. The right answer is radial pulse is most commonly used to detect the pulse rate of a client. Question number 12. A client under the nursing care suffers from chronic foot drop. The nurse can expect to find which of the following devices in the client's bedside. Option A, positioning boots, B, a bench, C, a mechanical lift, option D, two extra pillows. So in case of chronic foot drop, the nurse should anticipate for the positioning boots. Option A is right. That should be in the person's bedside, which can be used to treat foot drop. Question number 13. Proper body mechanics when lifting clients involve which of the following? Option A, bending at the knees, B, bending at the waist, C, keep the spine curved, D, avoid seeking assistance. The principle of body mechanics suggests us to bend our knees when we give the care while lifting the clients. So that helps to prevent any injuries to the backbone. Question number 14. Nurse witnesses the client with panic attack. The nurse must do the following. Option A, instruct the client to take deep breath and slowly. Option B, encourage the client to speak about panic attack. Option C, give patient cold foods. D, all of the above. So at the time of panic attack, the nurse should instruct the client to take deep breath and release it slowly. 15th question. Which of the following client is in orthopenic position? Option A, client who lays on his stomach with his face to the side. Option B, client walks using a stick. C, client sits in a chair with back straight. Option D, client sits on a bed and leans forward over a bedside table. So orthopenic position indicates option D, the client sits on a bed and leans forward over a bedside table, which enhances the respiration. Question number 16. Log rolling is a technique used for which of the following patient diagnosis? Option A, psychosis, B, cellulitis of the right arm, C, left tibial fracture, D. Spinal cord injury. Log rolling technique is used in patients suffering from spinal cord injury to prevent further damage of the spinal cord. Question number 17. If a client constantly ignores the urge to void, the client is putting themselves in danger of what complications? Option A. Constipation. B. Incontinence. C. Insomnia. D. Poor appetite. So when a client constantly ignores the urge to void, that leads to incontinence. The later complication will be incontinence. Question number 18. The following type of grief is considered as a normal and healthy part of a grieving. Option A. Complicator. B. Inhibitor. C. Anticipatory. D. Unresolved. So the right answer, anticipatory grief, is considered to be a healthy grieving pattern. So here the client foreseeing the problem which is going to occur, and as a result of that they can take measures to prevent those unexpected problems so that the grief can be avoided. Question number 19. For a patient who is on a clear liquid diet, which of the following is not allowed on this diet? A. Orange juice with pulp. B. Tea. C. Coffee. D. Water. The right answer is orange juice with pulp is not a clear liquid diet. Question number 20. A nurse sees a patient who is at his terminal stage of illness. The client states that if I pray every night, God will forgive me. This represents which stage of grief? Option A. Denial. B. Bargaining. C. Acceptance. D. Anger. So this scenario represents bargaining stage of grief reaction. 21. Which of the following procedure always requires surgical asepsis? Option A. Colostomy irrigation. B. Urinary catheterization. C. Nasogastric tube insertion. D. Vaginal instillation of conjugated estrogen. The right answer is option B. Urinary catheterization is a procedure which needs surgical asepsis to prevent any transmission of infection to the urinary tract. Question number 22. All of the following nursing interventions are correct when using the Z-track method of drug injection, except option A. Aspirate for blood before injection. Option B. Use a needle that's at least 1 inch long. Option C. Rub the site vigorously after the injection to promote absorption. Option D. Prepare the injection site with alcohol. So rubbing the site vigorously after administering injection in Z-track method will promote absorption. This statement is wrong. When you rub, that may lead to leakage of fluid, extravasation of fluids can occur. Question number 23. The primary purpose of a platelet count is to evaluate the option A. Potential for clot formation. B. Potential for bleeding. C. Presence of cardiac enzymes. D. Presence of antibody antigen response. The right answer is option A. The platelet count is evaluated to find the potential for clot formation. Question number 24. The appropriate needle gauge size for intradermal injection is option A. 20 gauge. B. 25 gauge. C. 22 gauge. D. 26 gauge. So in intradermal injection, the size of the guts will be more because the size of the needle is small. So option D is right. Question number 25. Which element in the circular chain of infection can be eliminated by preserving skin integrity? A. Host. B. Reservoir. C. Portal of entry. D. Mode of transmission. So here we can eliminate the portal of entry when you give proper skin care and you maintain the skin integrity. Question number 26. Dumping syndrome is a complication of option A. Colectomy, B. Nephrectomy, C. Subtotal gastrostomy, option D. Hysterectomy. So, dumping syndrome is a complication of option C. Subtotal gastrostomy. Question number 27. Antidote for organophosphorus is A. Atropine sulfate, B. Ranitidine, C. Magnesium sulfate, D. Vitamin K1. The right answer is atropine sulfate is the best antidote for organophosphorus poisoning. Question number 28. Which of the following patients is at greater risk for contracting the infection? Option A newly diagnosed diabetic client, B. Leukopenic client, C. Postoperative orthopedic surgery case, option D. Patient receiving broad spectrum antibiotics. The leukopenic client is at greater risk for contracting the infection because of decreased defense through reduced WBC cell. Question number 29. Which of the following blood tests should be performed before blood transfusion? Option A. Bleeding and clotting time, B. Complete blood count and electrolyte level, C. Prothrombin and coagulation time, D. Blood typing and cross matching. So before blood transfusion we must do typing of blood and cross matching. Question number 30. All of the following measures are recommended to prevent pressure ulcers except option A. Massaging the reddened area with lotion, B. Using a water or air mattress, C. Providing a meticulous skin care, option D. Positioning the patient at regular interval. The right answer is option A. We should not do massage over the reddened area with lotion. So this is contraindicated. All other steps are necessary for giving care for preventing pressure sore. Question number 31. Which one of the following diseases are preventable by vaccine? Option A. Tetanus, B. Polio, C. Leprosy, D. Pertussis. So the options A and B, B and D, C, A, B and D, option D, all of this. The right answer is option B, polio, and option D, pertussis can be prevented by vaccines. Question number 32. Which of the following is not a bird? A. Bat, B. Emu, C. Kiwi, D. Ostrich. Here, emu, kiwi, ostrich all lay their eggs and they feed. But the bat feeds through. Bat is considered as a mammal. Question number 33. Match the following. So in your left hand side you are having scientist and in your right hand side you are having work of the scientist. So match scientist with the work. A. F. G. Banting, B. J. Lister, C. Louis Pasteur, D. E. Jenner. The work 1. Vaccination for smallpox. 2. Germ theory. 3. Use of carbolic acid as an antiseptic. 4 is discovery of insulin. So we have the options here. So now we have to match each and everything. So after matching, this is the final result. Banting discovered insulin. Lister used carbolic acid as an antiseptic. Louis Pasteur developed germ theory, and Edward Jenner invented vaccine for smallpox. So option A is right. Question number 34. Which one of the following substances is made from natural raw materials? Option A, rayon. B, nylon. C, polyester. D, polystyrene. The substance which is made naturally is option A, rayon. Rayon is called natural silk. Question number 35. Television signals cannot be received generally beyond a particular distance due to option A, curvature of the earth. B, weakness of antenna. C, weakness of signal. Option D, absorption of signal in air. The right answer is the curvature of the earth does not allow the TV signals to cross particular boundary. Question number 36. Which one of the following is not an insect-borne disease? Option A, malaria. B, beriberi. C, plague. D, kala azar. Beriberi is not a insect-borne disease. It is a deficiency of vitamin B1. Question number 36. Which one of the following is not an insect-borne disease? The right answer is beriberi. Now move on to question number 37. What is the purpose of adding baking soda to dough? Option A, to generate moisture. B, to give a good flavor. C, to give good odor. Option D, to generate carbon dioxide. The right answer, we are baking sodium bicarbonate for the reason of generating carbon dioxide in the dough. When the sodium bicarbonate decomposes in the dough, it starts producing carbon dioxide. As a result of that, the cookies or the substances which you are making through dough gets soft and it becomes bulky. Question number 38. By which one of the following an old written material which cannot be read easily can be read? Option A, gamma rays. B, X-rays. C, infrared rays. D, radio frequency waves. The right answer is by using infrared rays we can able to read the letters written very olden days, which cannot be visible, can be read through infrared rays. Question number 39. The gas used in a refrigerator is option A, cool down on flowing. B, heated up on flowing. Option C, cool down when compressed. And D, cool down when expanded. The right answer is option D, the gas in the refrigerator. When it cool down, it gets expanded. Question number 40. The Celsius temperature is an A, specific temperature. B, absolute temperature. C, relative temperature. And D, approximate temperature. The right answer is option B, absolute temperature. 41. Light emitting diode converts option A, light energy into electrical energy. B, electrical energy into light energy. C, thermal energy into light energy. Option D, mechanical energy into electrical energy. LED converts the electrical energy into light energy. Question number 42. Dual energy X-ray absorptiometry DEXA is used to measure option A spread of solid tumor, B bone density, C ulcerous growth in stomach, D extent of brain hemorrhage. The right answer is DEXA is used to measure the bone density. 43. The main energy of sun is option A nuclear fusion, B nuclear fission, C chemical reaction, D mechanical energy. The right answer is option A nuclear fusion. Sun is a star in our solar system, so it gets energy by converting the hydrogen into helium by a process called nuclear fusion. Question number 44. The characteristic odor of garlic is due to which one of the following? Option A chlorine containing compounds, B fluorine containing compounds, C nitrogen containing compounds, D sulfur containing compounds. The right answer, there is sulfide present in the garlic. That's why the odor of garlic is like that. That is sulfur containing compound. Option D is right. Question number 45. Which of the following plants is not capable of manufacturing its own food? Option A algae, B carrot, C cabbage, D mushroom. The right answer is mushroom is a fungi and it is a heterophyte which cannot produce their food by themselves. 46. Which one of the following is considered as the easily digestible source of protein? A. Egg albumin, B. Soybean, C. Fish plus D. Red meat. The right answer is option A. Egg albumin is a easily digestible protein source. Question number 47. Sweating during exercise indicates operations of which one of the following process in the human body? Option A enthalpy, B phagocytosis, C homeostasis, D osmoregulation. The right answer is option C homeostasis. It is one of the homeostasis mechanism which helps to cool our body. Once our body is getting heat, we get sweating that balance the body temperature inside. Question number 48. Between which one of the following set of blood groups is the blood transfusion possible? Option A and D, B, Group B and Group A, option C, Group A and Group AB, option D, AB and O. So now we all know very well that, sorry, here option A, it is not D, it is O. A and O. Option A, the blood group, it is not D, it is O. So the right answer is option A and AB. Between this, blood transfusion can be done. Why means the group O is a universal donor, so that it is not possible to transfer. It can receive any blood group, whereas group B and A we cannot able to transfer because of the presence of antigen, and A and B can, sorry, AB and A can be transfused without any barriers. Question number 49. In human being, the opening of the stomach into the small intestine is called A. Cecum, B. Ileum, C. Esophagus, D. Pylorus. The right answer is option D. Pylorus. Pylorus is the pyloric area of the stomach through which it connects to the small intestine. The stomach is connected to small intestine in the pylorus area, pyloric area. Question number 50. Medicinal product and the source is given. You have to match it. A. Quinine, B. Morphine, C. Penicillin, D. Tetracycline, and you have the source as poppy plant, 2. Bacterium, C. Cinchona bark, and D. Fungus. So how you are going to match it? So after that, when you match, you will get this like this. Quinine is obtained from cinchona bark. Morphine is taken from poppy plant. Penicillin is obtained from fungus. Tetracycline from bacterium. So option C is right. A3, B1, C4 and D2. This is right. Now the subscriber challenge question. Question number 51. Autistic Pride Day is being observed on option A 28th June, B 19th June, C 18th June, D 17th June. Comment the right answer in the comment box below. This is the way to motivate a subscriber to learn independently. Thanks for watching this video. If you like this video, please click and watch that videos. Thanks for watching Sato Carry 2.0 on the nursing channel.